Let's talk about something most people never connect to fertility, and yet it silently affects millions of people worldwide. Hidden infections, undiagnosed STIs, and inflammation you can't feel. These are some of the most overlooked fertility blockers, especially for people trying for a baby and getting no clear answers. Today, we're breaking it all down, slowly, clearly, and without fear, because knowledge is power. You can have regular cycles, you can ovulate every month, you can even have normal hormone tests and still struggle to conceive. Why? Because fertility isn't just about hormones, it's also about environment. The uterus, the fallopian tubes, the cervix, and the reproductive tract as a whole. And infections, especially untreated ones, can quietly damage that environment, often without pain, without symptoms, and without warning. Infections affect fertility in three main ways. First, inflammation. Second, scarring and blockage. Third, changes to cervical mucus and implantation. When the body detects an infection, it triggers inflammation. Inflammation is meant to protect you, but chronic inflammation does the opposite. It can damage delicate reproductive tissue, block fallopian tubes, interfere with sperm movement, prevent implantation, increase miscarriage risk. And the scariest part? Many of these infections cause no symptoms at all. Chlamydia is one of the most common STIs worldwide, and also one of the most dangerous for fertility. Why? Chlamydia is frequently silent. Many people have no symptoms, but some people do experience discharge, pain, or burning. Yet over time, untreated chlamydia can travel upward, from the cervix to the uterus to the fallopian tubes. This can lead to pelvic inflammatory disease, also known as PID. PID can cause fallopian tube scarring, blocked tubes, increased risk of ectopic pregnancy, long-term infertility. Many people only discover this years later when trying to conceive. Gonorrhea is another STI that often goes unnoticed. Some people experience symptoms, many do not. When untreated, gonorrhea can also cause PID, and once the fallopian tubes are damaged, they do not regenerate. Even mild infections can reduce egg transport, affect embryo movement, increase inflammation in the uterus. Early treatment makes a huge difference. Late discovery often comes with consequences. These two are less talked about but extremely important. Mycoplasma and Ureaplasma are bacteria that can live in the reproductive tract. Some doctors dismiss them, others take them very seriously. Why the debate? Because in small amounts they may cause no issues, but when overgrown, they can disrupt fertility. They've been linked to recurrent implantation failure, recurrent miscarriage, cervical inflammation, and poor sperm survival, especially in people doing IVF or TTC for long periods with no clear cause. Testing matters, treatment matters, and balance matters. Bacterial vaginosis, or BV, is not sexually transmitted, but it can still affect fertility. BV occurs when healthy vaginal bacteria are outnumbered by harmful ones. This imbalance can change cervical mucus, reduce sperm survival, increase inflammation, and increase miscarriage risk. BV is especially linked to early pregnancy loss, preterm labor, implantation issues. Many people treat it once, but recurrent BV needs deeper investigation. Occasional yeast infections do not usually cause infertility, but chronic, recurrent yeast infections can signal an immune imbalance or ongoing inflammation. This may alter vaginal pH, reduce sperm motility, and indicate underlying issues like insulin resistance or immune stress. The infection itself isn't the main issue, the pattern is. Trichomoniasis is a very common STI, and one that's often missed. It can cause vaginal inflammation, cervical irritation, and poor sperm survival. Long-term infection increases the risk of PID, pregnancy complications, and fertility challenges. Testing is simple, treatment is effective, but only if it's detected. HPV is extremely common. Most people clear it naturally, but persistent high-risk strains can cause cervical changes, chronic inflammation, and implantation difficulties. HPV does not usually cause infertility directly, but advanced cervical damage or repeated procedures can affect pregnancy outcomes. Regular screening is key. Fertility is never one-sided. Infections in men can affect sperm count, sperm motility, and sperm DNA integrity. STIs and hidden infections can increase sperm DNA fragmentation, reduce fertilization rates, and increase miscarriage risk. Both partners should be tested, always. Here's the truth. Most standard fertility tests do not check for hidden infections. Routine blood work won't show them, hormone panels won't detect them, and unless symptoms are obvious, testing is often skipped. This leaves many people labeled as unexplained fertility, when the cause is actually undiagnosed infection. Depending on location and access, testing may include STI panels, cervical swabs, vaginal microbiome testing, semen culture for men. Advocacy matters. If something feels off, push for answers. The good news is, many infection-related fertility issues are reversible if caught early. Treatment may include antibiotics or fungals, partner treatment, probiotics for microbiome balance, and follow-up testing. Healing takes time. Inflammation doesn't disappear overnight, but many people conceive naturally after proper treatment. Even mild symptoms matter. Watch for recurrent infections, pelvic discomfort, unusual discharge, pain during intercourse, recurrent pregnancy loss, long-term TTC with no explanation. Silence does not mean safety. Fertility struggles are not a failure. They are often a message that something deeper needs attention. Hidden infections are not shameful, they are medical, and with the right care, many people go on to conceive. Your body is not broken, it just needs answers. If you found this helpful, save it, share it, and follow for more fertility education, because understanding your body is the first step towards healing.